Hello, my friends. I'm Dr. David Miller. I'm 60 years old, and I've spent more than 3 decades caring for thousands of patients, people just like you, who are entering a stage of life where every breath and every night of sleep becomes more precious than ever. I often tell my older patients, after 50, your health isn't only threatened by what you eat or drink, but by the smallest things like the way you sleep each night. Sounds surprising, doesn't it? But imagine this. Every night while you sleep, your heart keeps beating and your brain keeps working, filtering blood, clearing toxins, repairing cells. Yet, just one wrong sleeping position can silently restrict blood flow to the brain, lower oxygen levels, and damage tiny blood vessels, little by little, until one day they rupture, without warning. I once treated a patient named Marjorie, 72 years old, a retired teacher who loved gardening and reading. She came to me after a mild stroke. What shocked her most wasn't the diagnosis, but the cause. Her favorite sleeping posture, flat on her back with her chin tilted upward, had been worsening her sleep apnea for years. It reduced her oxygen at night, spiked her blood pressure, and over time, led to her stroke. After changing her sleep position, within weeks she began sleeping deeper, feeling more alert. She said she felt like she'd come back to life. I share this story because I believe prevention often begins with the simplest changes. When we're young, our bodies can endure mistakes. But after 50 or 60, every little habit can make the difference between waking up healthy or waking up in a hospital bed. Most people think stroke is only about cholesterol, blood pressure, or heart disease. And while that's true, it's not the whole picture. What you do during the 8 hours you sleep each night profoundly affects blood circulation, oxygen delivery, and brain vessel health. Because while we sleep, our body isn't resting, it's healing. And if we sleep in the wrong position instead of recovery, our body suffers, silently. So today, I want to take you through the sleeping positions that quietly raise your risk of stroke, and show you how small adjustments in your head, neck, and shoulders can dramatically improve circulation and protect your brain. But before we dive in, I want to ask you something. Have you ever woken up in the morning feeling heavy-headed, dizzy, or exhausted, even after 8 hours of sleep? If so, then this video is for you. Because sometimes your health isn't in a pill bottle, it's in the way you lay your head on your pillow. Let's take a closer look at the sleeping positions science has linked to higher or lower stroke risk, and most importantly, how you can adjust them to protect your brain and your heart. I promise you, just one small change tonight could help you sleep better and live longer. When we talk about stroke risk, most people think of diet, blood pressure, or stress, but few realize that the way we lie down each night could be the final drop that makes the vessel overflow. I'll never forget one Monday morning when a longtime patient, Thomas, 68 years old, called me in a panic. "Doctor, I woke up and couldn't lift my left arm." He had a mild ischemic stroke, not from cholesterol or diabetes, but from years of sleeping on his right side, neck bent at an angle that slightly compressed his carotid artery. Over time, that reduced blood flow to his brain. After changing his sleep position, practicing breathing exercises, and using a better pillow, his dizziness and morning numbness completely disappeared. Now, let's break down the common sleeping positions and why they matter. 1. Lying flat on your back with your head tilted up. This feels comfortable, but if your neck is hyperextended, it can compress the carotid arteries, restricting blood flow to the brain and raising the risk of stroke during sleep. Choose a low, soft pillow that keeps your head aligned with your spine. 2. Sleeping on your right side. It may feel relaxing, but studies show this increases pressure on the heart and slows circulation, especially dangerous for people with high blood pressure. 3. Sleeping on your left side, the safer choice. If you must pick one side, choose the left. It supports better blood flow from the heart to the brain and eases pressure on the lungs and stomach. 4. Sleeping on your stomach, the silent enemy. This position twists the neck and increases chest pressure, restricting blood flow and raising the risk of sleep apnea and stroke. 5. The fetal position, curled too tightly. While cozy, it restricts your diaphragm, reducing oxygen intake. Over time, this can lead to fatigue, brain fog, and poor circulation. 6. Sleeping upright or in a chair. common among older adults after dinner, but this drains blood to the legs and deprives the brain of oxygen, a dangerous combination for those with heart conditions. 7. Sleeping with your head lower than your body. This increases blood pressure in the brain and can cause microbleeding in fragile vessels. Always keep your head slightly above heart level. 8. Poor pillow or mattress support. A pillow too high or a mattress too soft bends your neck and spine, silently affecting circulation over time. Invest in a medium firm mattress and a low, supportive pillow. Changing the way you sleep isn't easy. I know. But if you're going to spend 8 hours every night in one position, make it a healing one. Tonight, adjust your pillow. Roll slightly to your left. Relax your neck and shoulders. Tomorrow morning, you might be surprised. Your head will feel lighter, your heartbeat calmer, and your sleep deeper. Because sleep isn't just rest, it's the natural medicine our bodies rely on. And sometimes one simple position can change or even save your life. Over my 30 years of practice, I've learned that it's not the big diseases that scare me most. It's the small habits we overlook. A wrong sleeping position, a neglected routine, little things that slowly steer us off course. I've heard countless patients say, "Doctor, I thought I was just sleeping poorly. I didn't realize it was the first sign of a stroke." And I always tell them, it's never too late to start again, even with how you sleep tonight. Your sleep mirrors your true health. If you wake refreshed, your heart and brain are grateful. If you wake with headaches or stiffness, your body is asking for help. So tonight, before you lie down, take a moment to listen to your body. Is your pillow supporting your neck? Are your shoulders relaxed? Are you lying on your left, where your heart and brain can truly rest? One small change can mean the difference between a restless night and a longer life. Because at 60, 70, or even 80, life isn't winding down. It's the time to live wisely, gently, and deeply. You've spent your life caring for others. Now, let your body rest, so you can live longer, stronger, and happier. Thank you for spending this time with me. If this video helped you realize something valuable, please share it, because your simple action today might save someone you love tomorrow. Wishing you a peaceful night, a full heart, and a healthy morning. And join me next time. I'll be sharing 3 golden secrets to help you sleep like you did in your 20s.